Moody.
Thank you. Chairman Kasich, Governor Kasich, I have always been grateful for that 1995 Medicaid assignment because over the years I've really come to experience that as the call to serve, and the original invitation to do that was yours. Many of the issues are the same today as they were then, but in all the time since, I've never had the sense of the urgency and the opportunity to really transform these programs to improve health and to improve how we serve our neighbors. I appreciate the opportunity to serve in the administration and for assembling this team of directors. You know, for you all, your commitment to seek justice and love kindness in the work you do stands out, it's apparent, and I think it's going to be fun working together to see where we can take that. That is what I think will provide the strength to face any challenge we might have. The Office of Health Transformation will carry out the immediate need to address Medicaid spending in the budget and plan for the long-term, efficient administration of the Health and Human Services Group. Joining me in the office, I'm pleased to introduce you to our Director of Government Affairs, Elise Spriggs, our Director of Communications, Eric Poplar, and our Director of Stakeholder Relations, Monica Yenger. To the team and to all of you, now is the time for us to do our part to raise the bar on health system performance. The discipline of the budget process will give us about 20 weeks to set a better course. That's not much time. Governor, I know you're ready. We're ready. Look forward to working with you to see where this takes Ohio. Dr. Winslow?
Thank you, Governor Kasich, and thanks, Greg, for the introduction. I appreciate the trust you've shown to me and providing me this opportunity to lead the Ohio Department of Health. This is a real pleasure and a rather frightening moment at the same time for me. I wasn't certain about coming into this position until I met the people that are going to be in a leadership position with me. And I was really impressed with the level of commitment and focus that this group has, and the energy is impressive also. I have little trouble keeping up with the people surrounding me, and that's a good problem to have. I'm 30 years in family practice, so I know the world from the point of view of a primary care physician. I intend to carry that view into my position of leadership in the Ohio Department of Health. The last 2 years I've been especially involved with the patient-centered medical home, which many of you have heard about, many of you have read about, and I want all of you to see it. And I'm here to make sure that those core principles are carried out in the various interfaces that we have while we're facing the challenges that we have now of trying to enhance the quality of care that we deliver, but we've got to do it at a reasonable cost. And we've got to have smart people putting their heads together that can go through the process of finding where we can make change happen that ultimately leads to improved health for our patients. Wellness has been a focus of the Department of Health for years. That will be maintained under my leadership because I really feel that and a personal relationship with a primary care provider over time are the keys to success if we ever hope to impact the quality and quantity of health of our Ohioans. So I'd especially like to thank my family, though, for allowing me to do this, because that took a bit of a leap of faith, and especially my wife, Janet.
Where is she?
She's right in the third row.
Janet, stand up and get a round of applause.
We've got a tremendous team assembled here. I have confidence in them, and I believe in what you believe in, Governor Kasich, and your team does, and thank you for this opportunity.
Thank you, Doctor.
Thank you.
Good morning, everyone. Thank you, Governor Kasich, so much for your confidence in me and most importantly, for your strong commitment to Ohio's older adults and their families. I've dedicated my life, both professionally and, as my family will tell you personally, to helping our elders, those who built this country, live their lives with choice and with voice, even as their care needs change. Every so often, and I guess not as much now, and in the future, I pick my 2.5-year-old granddaughter up from preschool. And every day I do that, we pass a long-term care community on the way home, and I ask her, who lives there? And she says to me, our beautiful elders, Grandma. Well, actually she says Gamma, but that's another story. We need to start very, very early with our messaging. Each and every one of you in this room can think of an elder who deserves to live their lives with meaning, to live their lives with choice about how they live and the kinds of supports and services that they need and receive. Our Department of Aging is dedicated to providing choice, independence, and quality of life for all of our beautiful elders, as my granddaughter calls them, both while they're fully engaged in the community and as their care needs change. While the department will clearly be one of the engines driving our state's policies and programs in aging, serving our elders and preparing for the future of Ohio's aging population is not the sole purview of any one department. It's not the sole purview of any one agency, or, as our governor has said, of any interest group. Instead, one of the core functions and missions of the Department of Aging will be to work in collaboration with all other state units and agencies so that the concerns and the opportunities that our aging population provides us becomes part of their agendas as well. It is only by working together that our Ohio's older citizens will have choice in everything they do and in everything they need. I'm so looking forward to working with my colleagues here today and the dedicated folks throughout the state, consumers, providers, and stakeholders galore, to fulfill the mission that I know every single person in this room shares with me, to ensure that all older adults in Ohio, today, tomorrow, and into the future, live meaningful, self-directed, and purposeful lives. Thank you so much, Governor, for this opportunity to serve.
Every once in a while, you know, a light goes on, and I think you're all getting the sense that I'm really a reformer. And I'm always looking for places where things can be different and better. And Bonnie has turned some lights on. I mean, like, for example, I've been on boards where they tried to impose an age limit and I voted no. Because I think our seniors they are such an untapped resource. But she's talked to me about the ability to give them more choice and more freedom in small ways that yield very significant improvements in their life. And this whole area, I think, is largely unexplored. And I think that because of her work at Ohio State and her work out in the community, we have a real opportunity just by saying that senior citizens have rights that somehow have been eroded in the name of, you know, I don't know what it is, in terms of maybe taken care of. But there's a lot of change that is really, really possible. So it's great. We're glad you're doing this, Bonnie. So I'll sign this order. Is that right? Oh, sorry. John, I'm sorry. Don't quit. Okay. Don't quit now. Did you bring your wife?
No, my wife's not here. Okay. First, of course, I'd like to thank the governor for being selected for this position. It's truly an honor and a privilege. This is very exciting for me. I've been working in Medicaid for about 15 years, and being asked to fill this position at this time in Ohio is just a true honor. We are at a time in Medicaid that's truly on an event horizon. There's a lot of changes going on, and Ohio is ripe to implement a lot of these changes. as Greg talked about, and as the governor has talked about, there's two things that are looming, right? The budget is always an issue. But at the same time, how do we break down the barriers that are right now we see in a lot of different areas? And we have the other directors here at their announcements last week. There's a lot of discussion of that. And that's what I'm looking at, and I'm saying this is an area that we can change right now in Ohio. How do we break down those barriers? How do we improve the health outcomes for individuals in Ohio? And the district, that's what we took on. We were spending $2 billion, and we didn't know what we were spending $2 billion on. We just spent $2 billion. Our health outcomes were horrible. We were last in a lot of different places. We turned it around. We put beneficiaries first. And we said, we want to improve health outcomes. And slowly we started seeing that through the types of incentive payments that we were putting into our reimbursement systems. And that's what I want to bring here, to see how we can change those things. Is it going to be easy? No, it's not going to be easy. It's going to take all of us. It's going to take this team up here, but it's also going to take many of you in this room. Providers, advocates, working together to figure out how we're going to do it. Are there going to be some tough decisions to make? Yes, there are going to be some tough decisions that have to be made. And not everyone's going to be happy. But I know through the governor's leadership and the vision that we're going to be able to get this done. So thank you again.
Thing before, can I then sign that order? Okay. Look, you're smart people. Help us. Okay? It's not like we're starting today, by the way. We've been working on this for years. And we don't know everything yet, but we've done, it's like we're not going from a standing start. But the people that can come in and help us with their good brains are people that get a lot of respect in our administration. And we need you. You know, that speech I made over there on the inaugural, I hope some of you had a chance to see it. You know, we're all in it together. And if we all can just use our good brains to figure out what's not so much in it for us, if we could just for a second kind of just come out with the best outcome, I can tell you, you will become an important advisor to us. As I tell everybody, just, don't be biased. You can tell us what your bias is, but then give us your good advice. And if you do that, it's going to go a long way to making you a much more influential person over the period of this next 4 years. Now I get to sign this. Okay? So Greg, this is going to make you a very important person, and I love it, and it's going to be terrific, and we will work with the insurance, everybody. We're going to pull everybody in these things, and it's going to be a great day for Ohio once we're able to get all this done. Mike, you need to take that executive order and carry it to the